Hi everybody, it's Marty, and I promised an update video. It took a little bit. There's still dye in my system, which can give you headaches and just kind of make you feel particularly weird. So let's just move forward with it. I had a myelogram on Wednesday, and the um, the the whole experience was just straight bizarre. Um, I I work very hard to make sure that my body and that I'm prepared for these tests, and I actually arrived an hour early, and I had everything set up, and they took me back, and I had a really weird experience. I have these facet injections in my neck and my back, to help me deal with pain. And I guess I made an assumption, and I assumed, as per the previous procedures, that I would be given some medication or some mild conscious sedation for the procedure. Now, anyone who doesn't know what a myelogram is, it's basically a kind of like a spinal tap in reverse. There's a lumbar puncture. They go into your lower spine, into the lumbar area, and they they put dye in there instead of drawing fluid. They put dye in there, so it creates a white background so that they can see like every little crack and crevice of your spine. And the reason I was having that test was because I've had this will be my second rejection of a either cadaver implant or now a titanium implant into the C6, C7 level, that has been rejected. Now, on the previous surgery, there were rejection at two levels, but for this level, this is the second rejection. It's still early on, so we're not sure if if that other disc that had rejected before, um, is safe just quite yet. But anyhow, we're dealing with the disc at the or transplant at the C7 level, and we've got to know the integrity of my spine, of the C7 vertebra, is if the integrity is enough to place a screw in there, and why the screw now has backed out, and why I might be looking at another surgery, and if there should be another surgery, how they'll go about it. So I go in to the procedure, and they're not willing to offer me any sedation. So now uh, the 9-year-old little boy that has already gone through this, God knows how many years ago. I think it's like 35 years ago. 44 now. It was 9 then. So 35 years ago, I'd had all these tests, spinal taps, myelograms, just every test under the sun to test my brain and test for aneurysms and stuff like that. And they're not offering me any sedation whatsoever. And fortunately, I was smart enough to bring mom with me to the test. I don't know why. I really didn't want to drag her out of the house, but for some reason I had taken her with me that day, and they had offered to reschedule the test, to postpone the test, and to have the doctor prescribe me the medication that I'd need in order to not move while they've got a needle in my spinal cord and paralyze myself. So I said, listen, I don't know, I need to call in a lifeline here, and they're like, what do you mean? I was like, well, I'm at this point, I am unable to make a decision for myself. And my mom actually happens to be in the waiting room. She was with me 35 years ago when I had this test done, and I think she'll be able to offer me some help with this. Well, fortunately, they bring my mom in the room. My mom is fit to be tied because she thinks they've done something bad to me, and not the case. But I explained the situation to her, and she's kind of beside herself at this point, and we're ready to pack up and leave. And she says, "Wait a minute, Marty. didn't you tell me to make sure that we didn't leave the house without your medication? And I said, Mom, you're absolutely right. I do have my medication in my pocket. She said, is that going to be enough to get you in the right mind place so that you can relax enough for them to keep this needle in your spine for 5 minutes? And I said, yes, it will. And so I had a Vicodin in my pocket, and they went and ran and got my jeans, and I took the Vicodin, and I made them wait 20 minutes. That's the least they could do, since they wouldn't take 2 minutes to call the PA for my surgical practice, who just happened to be on the floor above us, and page her and get that prescription written. It could have all been done in moments, and they would have been glad to do it for me. They know my situation, and they know my fear of doing any further cord damage. So, and anyways, they went on with the test, and the needle went in fine, and they got the dye in, and then that actually was not so grisly. It's a deal, but the problem arose when the dye won't go. The dye won't go any further up my spine than where they put it in. And the doctor's like, well, this stenosis is pretty severe. We're gonna have to tilt you and tip you. And well, Marty doesn't know he has stenosis of the spine. I mean, when you have the types of disease I have, and you're dealing with this sort of thing, you figure when they throw things around like spondylosis and stenosis and stuff like that, you figure you got probably a little bit of everything, and a little C this and a little L that, and you just stop thinking about all the terms and little things that they talk about. But stenosis is a big deal. Stenosis is a big deal, and it's a game changer for me. And they're just talking about it like I've already been diagnosed, like I know about it, and I'm going on and on and on about it, and they can't get this dye. They can't get this dye past my the intersection of the lumbar and the thoracic spine, which means in short terms that my spinal fluid is not running up and down my spinal cord. And it could mean a lot of things. It could be an answer to a lot of untold questions. The reason why I'm going through the paresthesis, and for those of you folks who are not familiar, paresthesis is when someone deals with constant numbness of the limbs, arms and legs. And I'm not just talking about tingling or prickly feeling or a little bit of numbness. I'm talking about going for hours or maybe all day or maybe a week where a limb has gone numb or is not communicating with the rest of your body. And this I deal with on a regular basis, and why I use the cane and why I often use a back brace, so that my posture is proper, and so that everything is circulating right. And when I'm having a really bad time with my back, I use the brace, and it does seem to help out quite a bit with me being able to get my legs. As it is right now, I really can't feel my legs in the morning until I've taken my medication, until some of that pain is gone, for my legs to kind of boot up, to communicate with my brain, and they get moving. But it takes about 2 to 3 hours for me every morning to actually wake and get dressed and eat and shower and brush my teeth and stuff like that. It's a little bit of a hassle, but so we've got something new on board here, and it's not new. It's something that I've been dealing with for a while. And after doing a little bit of research, apparently it's not easily picked up unless a myelogram or a certain test like this is done. It's not something that they would have known about. And there's up to date, although I've had numerous studies on my cervical and lumbar spine, I have not had a whole lot of studies done to my thoracic spine. It was the last bastion of healthy spine that I thought I had. I mean, of course, the scoliosis is there, and there's disc issues, but not anything in common with the person with the curvature that I have. So after going through all this, and after feeling so incredibly vulnerable, and them just kind of forcing me out of a time issue to go ahead with this procedure, Now, they just said stenosis, and they may as well just put a knife in my heart because, it was really bad. It took them an hour to get me situated right. I mean, I tried forward Superman, reverse cowgirl, whatever the hell position they told me to get into. I got into it, and I'm face down. They've got me on this like teeter type table, and they got me all the way down, and the nurse is standing there making sure I don't slide off the damn table. And the only thing holding me up is these great big metal bars that they placed in front of my shoulder. Now, you guys know me. My shoulders are like, it's the worst pain that I have, and it's crippling, and it just, I can't even explain how painful my shoulders are right now. Um, it just rocks me, and I've got to put them on metal bars, and not a pillow, not a sheet, not a cushion, nothing between me and those metal bars. And now these metal bars are holding the entire weight of my body on this downward sled. Well, the myelogram results probably came in this afternoon, but it's snowing here on the East Coast, and so I didn't get them back today. I really do need the results. I have to have the results because we got to figure out what's going on with my neck. But once my neurosurgeon, sees the stenosis, um, of course my neck has to be fixed, but it's going to be of very little importance now that there's actually, damage in my spinal cord. It, up till now, I mean, the spinal cord has been compressed and I've got issues, but nothing actually blocking the flow of the spinal fluid going up and down my spine, and it's worsening, and my disease is now worsening, and if you wanted to look stenosis up on the internet, you feel free to go forward. But if you know me very closely, you'll see how it ties in to the problems I've been having, and this stenosis in the thoracic spine it's not rare, but it is, however, a very a small percentage of people diagnosed with stenosis have it in their thoracic area. So it's a huge problem, and when it's severe, sometimes they can do a laminectomy. There's a surgery. It's an in and out surgery. There's really no in and out surgery with the spine, but in this case, it would be a lot easier. But I'm not sure that is even something that I would be eligible for. So but I really don't see any way out of a surgical intervention. Of course, I hire people to take care of this for me, and so my neurosurgeon will get back to me and he'll set me straight on this. But it's I don't know. I wasn't expecting all this. I really wasn't expecting all this. Um, and I severely underestimated the effect of the loss of my father on my general affect, and I'm sad. And his loss is and when he died, a part of me died with him, and it's the only way I can explain it. There's just a huge hole now, and it's really making it difficult to put things in the proper perspective. So I guess that's my whole point, is that I'm having a very difficult time getting my mind in the right place, is to not be negative or to not get into an area of pity. There is work to be done. There's a lot of work to be done. Um, it's not by me anymore. I mean, if I was under the impression in the past that there was anything that I could do to stop or prevent this disease, I was mistaken. I've done the very best I can to keep myself moving and to make a better life for myself. But at this point, it's in the hands of the surgeons, and I'll just have to leave it to them. And I'll need you sometimes to remind me you know, that, gosh, I'm really sorry about that. Um, I'll need you guys to occasionally remind me that, that this is in their hands now, and don't think so much about it. Um, I need to find joy, and I need to find joy quick, and I need to do stuff, dumb stuff like go to the movies and have fun, and learn how to have fun again, and learn how to appreciate some nice things, some fun things. I deserve them, and so I'm just gonna leave it at that for right now. I'm sorry about the long video. I don't know how it got so long, um, but time kind of gets lost. I love you guys, and thank you.